Now time to move on to lateral elbow.
I'm going to show you the probe positioning for scanning the lateral elbow. So patient position is usually supine with the arm in a little bit of internal rotation. The landmark is going to be the lateral epicondyle. I take my non-dominant hand and place the middle finger proximal to the lateral epicondyle and my thumb just distal to the lateral epicondyle. That then forms a pincer grasp for the probe. The lateral epicondyle goes directly in the middle of the probe, otherwise it's too easy to miss it, for example, if it's like that, so you put it directly in the middle of the probe. We're now looking directly down at it, and we make the orientation of the probe is long on the forearm, and the movements that I'm going to make are really fine micro movements towards the shoulder, or distal off the lateral epicondyle. I can make some small angulations until the lateral epicondyle and the radius appear clearly in the view.
Okay, so now time to draw it. So what do we know? Well, we know that this bright white stuff is the humerus, specifically the lateral epicondyle of the humerus. This is the radial head. Now in this specific angle, the shaft will continue on down like this. In this specific angle, we kind of drop off the shaft, and I think it's kind of running down like this. So what else do we see? Cartilage. Well, the articular cartilage of the humerus is there. The articular cartilage of the radial head is there. Fluid, well, we know all in here is joint fluid. Ligament, well, what connects bone to bone is ligament. And some people have done studies on this. So John Jacobson, for example, and his group have done a study where they proved that this essentially bottom half of the picture is ligament tissue, okay? And the top half of the picture is tendon. And then muscle, well, we don't see a ton of muscle in this view, but that's essentially what all this is down here, all this black stuff here, okay? So we're going to clear that away and draw it one more time. Bone, bone, articular cartilage, joint fluid in here, ligament, again, based on this study where they've dissected cadavers, they had a surgeon dissect away what the surgeon thought was ligament tissue, looked like ligament tissue, and stopped when they saw what looked like tendon tissue. So essentially it's the bottom half. The tendon is the top half. And muscle, when we know muscle has a ton of blood, and so essentially this is all muscle here in this picture. Okay, time to move on to a live model. Now, I want you to note that the pictures on the left are going to stay the same. However, we're injecting the contralateral elbow. So the patient actually has the lateral epicondyle on that side of the screen, on the top right.
Going to show you how to do a lateral elbow scan and injection.
So again, lateral epicondyle is going to be over here.
The affected elbow is on the opposite side of the table, with the elbow bent 90 degrees. The landmark is going to be the lateral epicondyle of the humerus. We'll put that in the center of the screen now. And the probe orientation is the distal end of the probe pointed towards the third finger of the hand. The area of interest I'll point out now with the yellow arrow. And to do both a cortisone injection and a hyaluronic acid injection, the needle would land right where the yellow arrow tip is. The needle entry angle is like so. For PRP, we generally go into the tendon, so the target would be into the tendon itself with the same needle entry angle. And that's how we scan and inject the lateral elbow.
So apologies for that. I do know that that's a little confusing when we mirror it, but essentially the sonoanatomy stays the same. Okay. Now time to move on to the quiz. Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.